I know it's still so difficult to understand the difference between KRN and KRCHN. Does the CH in between make any difference? And I know most of the time you'll go to the clinicals and see some other nurses signing as KRN and some signing as KRCHN, yet they all still work under the same roof, and you'll be wondering, are they the same? Have they done the same course? And what is the difference between the two? So that is what we're going to talk about today. Hello beautiful people, welcome back to my channel. If you're new here, my name is Lesodor, and on this channel I talk about nursing and I also do nursing and lifestyle vlogs. So most of the time the question usually is a community health nurse an RN? Before I answer that question, we'll first come and look at KRCHN and what they do, because I've done KRCHN. So we'll look at the course, that is KRCHN, and what they do when they become nurses, and also look at RN. So after we've understood these two, that's when we'll see if the community health nurse are an RN or if RN is different. So let's get into the video. So I'll be explaining my points, and I have some of them written, so if once in a while you see me looking down, I'm just confirming so that I don't forget any detail. So for you to attain the name, for you to be able to be a KRCHN, first of all, you need to have at least a diploma in nursing, and for you to be able to get a diploma in nursing, you have to apply for it in a registered institution or any medical institution that is registered and that is known. So you'll apply, and for most of these nursing school and for most of these medical schools that have nurses, they usually require you to have a mean grade of C plain. If you want to apply for KRCHN, you need to have a mean grade of C plain. You need to have a C in biology, a C in English, and a C minus in mathematics. So when you've already attained those, that's when you'll get into like nursing school and start studying to be a KSHN. So before it used to take 3.5 years, that was for KMTC, and right now it's 3 years. I'm really not sure about the other nursing schools, but most of the time it's usually either 3 years or 3.5 years. So during the 3 years, what is it that you're being taught? Like, what type of a nurse is it that you are being prepared for, and where can you work after you've been prepared to be such kind of a nurse? Like, where do you go for attachments, and how is that relevant to the place that you're going to be working by the end of that practice? So first of all, usually do community health nursing, because as community health nurses, most of the time we usually work so much in the community. Like, most of the time when you go to those dispensaries that are there in the village, you'll find that the nurse is the one who's usually in charge, and most of the time they're usually the KRCHNs. So when you are there and you're in charge there, and you are there as a nurse, you are working there as a community health nurse, and you're serving the community, but you're the one who is in charge there. That doesn't mean that there's a lot of, like, you are not supposed to do everything like the way a doctor does, because you are allowed to refer. If something is so big for you, you just refer, but you work in the community and you treat the minor ailments and you do such kind of things. The other place that you're being taught is to become a midwife, because we do a lot of midwifery, and that's why when you get to the maternity, you'll always find KRCHNs are the ones who are there in a very big numbers. You always find KRCHNs. So you are taught midwifery so that you can work in the maternity, and you can also work in the maternal and child health care clinic. Another thing is about med-surg. Like, it is one of the biggest parts that we usually study. Like, we've done a lot of med-surg. And for med-surg, now you'll find that nurses usually work in the ward. That is for general ward, that is for the medical ward and the surgical ward. So you'll find that KSHNs also work there, like they work as nurses to take care of patients, like giving medications and all the other nursing care that you have to do for a patient. That is for the medical ward and the surgical ward. So that's why we do med-surg. Another thing that we do is pediatric. So that's why you see most of them becoming pediatric nurses. So you'll be able to work in the pediatric unit and take care of children. Another place is psychiatry. We also do psychiatry, and most of the time, if you really need to specialize, you can do KRN, mental health and psychiatry. That is a different one, and they usually do it for 3 years. So when you do KRN, mental health and psychiatry, you'll be able to become a psychiatric nurse. But if you've also done KRCHN, you also have a whole unit of psychiatry, and you can also work as a psychiatric nurse. Another place is the casualty and emergency unit. So most of the time, you find that most of the nurses there, also the KSHNs, they usually work in the emergency unit, and that is the area around the casualty, because we also do first aid and emergency. Another place is, we also have so many other related places like theater and renal unit, like so many other places, and we are taught all these things during the 3 or 3.5 years while we are in college. Then now you'll wonder, so are we clinical nurses or are we community health nurses? Because about KRCHNs, yes, we are clinical nurses, but in combination with community practice. Like, yes, we work in the clinicals, but you have to work like, there's a way in which you have to work like a community. You have to work like you're not only serving one person as a patient, but you're serving the entire community. Then by the end of that practice, what happens? Because you might ask, so by the end of that practice, am I a clinical nurse? Am I a midwife? So when it comes to KRCHN, by the end of that practice, you are a clinical nurse, you are a community health nurse, and you are a midwife. All those 3. So that is it for KRCHN. When it comes to registered nursing, for you to become a registered nurse, you need to have an associate degree in nursing or to have a bachelor degree in nursing. And for the registered nurses, most of the time where they usually work is in the hospitals. That's why when I started this video, I told you that you might find a registered nurse and a KRCHN working in the same place, and you are like, is it okay? Like, yes, it's okay, but it's only like they have, let's say they have, I don't want to say about their ranks, but I want to say like they have different names, you get me? So they also work in the hospitals, and that's why you also see them in the wards. Another place is that most of the time you'll see them in medical offices. Like, most of the time it is the RNs that are more in the medical offices. So the time that I realized that, there was this time we had an RN, a nurse at a certain ward. So we were there, you know, we usually combined, like when we go for attachments, we usually combined those who are doing diploma and those who are doing degree. So there was this nurse who was telling another student, I think the student was from JKUAT, and she was telling her, like, you know, I know you people are just lazy because you'll just be busy sitting in offices. Like, that was so cruel. Like, you know, most of the time they're the ones usually in the offices, but don't just put your mind that you're going to stay in an office. Like, you're more than that. And those offices, those nurses who sit there, like, they sit there for even 20 years or something. So you just can't have your mind that, me, I don't want to work in the hospital, I don't want to work in the wards, I just want to just prepare myself to work in those offices. Like, it's not just like something that will come in a day. You need to have gone through those wards, you have like gone through so many things for these people to trust in you, so that they can see that you can be able to be ranked and to be sitting in those offices. Like, you know, people usually just envious and wondering, like, she can just be sitting in the office, going home whenever they want, and I'm here in the ward just struggling and struggling. Yeah. So what I was trying to say is that most of the time you find that, yes, we also have KRCHNs in those offices, but most of the time, let me not lie to you, usually the registered nurses who are usually in those medical offices. Then another thing that they usually do, they're usually also in the clinics. Like, they're also just everywhere where the KRCHNs are, and that's why we always usually work together. Another thing is that when it comes to how they're being paid, like, let me not tell you that I'm certainly sure about that, but what I usually know is that the registered nurses are usually paid more. But something that is there is that, I don't know, like, most of the time when you ask these nurses, like, how much are you being paid, so that at least you can like compare, like, no one usually likes telling you about how much they usually paid. Like, I've asked over 10 nurses about like their salary, but no one says anything about their salary. Like, they usually just say, finish college, get there, and then you'll see it for yourself. And I'm like, so if you tell me how much you're being paid, like, how will that you go? But anyways, I usually know that the registered nurses are paid more, but I'm not sure about the amount, because the way they say, you get there and see it for yourself. So I'm waiting for me to get there. When I get there, I think like I don't have an issue. Like, I just tell guys, if I'm earning 60, it's 60. If I'm earning 50, it's 50, and there's nothing anyone can do about it. So about the payments, like, I know one is higher than the other, but I'm not sure about the figures. So finally, because I know most people who are watching this video are doing a diploma course, especially for those who are doing it in KMTC. So finally, what I'd like to say is that when you're doing that course, your designation will be Kenya Registered Community Health Nurse. But that doesn't mean you're not registered, because I used to get some people getting to my DM and they're like, so if I'm not an RN, so does that mean that I'm not a registered nurse? And I'm like, the title just says Kenya Registered Nurse. So just, if it really disturbs you, don't concentrate on the community health part, but that is just it. We have the community health part. So I hope I really helped someone who was being confused with the two, and I hope you liked this video. Just make sure you give it a like and make sure you have subscribed if you haven't. And thank you so much for watching this video. See you on my next video. Bye bye.